Welcome to Lecto. Today we are going to discuss introduction of upper limb. Let's see. Actually, we divide upper limb into four parts: shoulder region, arm, forearm, and hand. Here you can see in detail that we divide shoulder region into three parts: pectoral region means shoulder region, axilla or you can say armpit, and scapular region which is the back area, and arm which is also called brachium has no region. Forearm antebrachium has no region, but hand which is also called menis, the region include wrist. Here you can see this is the wrist portion, and proper arm we can say palm, and next fingers or you can say digits. Here you can see there are 5 digits: thumb or you can say pollex. Next one is the forefinger or you can say index finger, then middle finger, then ring finger, and last one is the little finger. So these are the 5 fingers which are actually the part of the hand. Next, the bones included in the shoulder region. Here you can see the bones included in the shoulder region: clavicle and scapula. Here you can see clearly that this is a clavicle bone which is also called collarbone, and here is the scapula. And the arm region, in the arm region there is a bone which is called humerus, and below in the forearm region there are 2 bones, radius and ulna. But keep remember that at the thumb side radius is present, and in the hand or you can say in the wrist there are 8 bones. 8 bones of the carpal, and in the palm region there are 5 bones, and in the fingers there are 14 bones. So our total bones will be 32. Hey, these are 1 bone having 1. So overall bones will be 32. 32 in one arms and 32 in other arms. So total will be 64 bones present in the both upper limbs. So these are the bones, and the joints which are present in 4 region. In the shoulder region 2 joints: Sternoclavicular joint. Actually the clavicle is joined with the sternum. Sternum joined with the clavicle, so we call it sterno from the sternum and clavicle from the clavicle. Sternoclavicular joint joined between the sternum and the clavicle. Next is the acromioclavicular joint, because clavicle joined with the scapula. What part of scapula? Acromion process. Actually there is a notch like structure, there is a projectioning at the scapula, and from this projectioning here you can see there is a projection which is called acromion process. So clavicle joined with the acromion process, and the joint formed between them will be acromioclavicular joint. Next, in the arm region, the humerus joined with the scapula. Actually there is a cavity at the scapula. Here there is a cavity, and the humerus joined with the scapula. There is a cavity which is called glenoid cavity present in the scapula, and here you can see this is a humerus head, and humerus head fuse in the cavity of the glenoid, and they can move easily or rotate easily. So the joint formed between the scapula and the humerus is called scapulohumeral joint. Next, in the elbow, which is also called cubitus, the elbow joints between humerus, radius, and ulna is actually the elbow joint. But joint can also be present between ulna and radius. Two joints between the humerus and radius or ulna, and the between the radius and ulna there is another joint which is called radio-ulnar joint between the radius and the ulna. Next is the wrist. The joint between the radius, ulna, and the carpal bones is the wrist bone. And there are several joints also present between the carpal, and the joints formed between these carpal bones are called intercarpal joints between carpal bones. Next is the carpometacarpal. It means the joint formed between the carpal and metacarpal bones are called carpometacarpal joint. Next, here you can see metacarpal bones can also form joints between themselves. So joint formed between metacarpal bones are called intermetacarpal joint. Next, phalanges, and the joints formed between the metacarpal and the phalanges is called Metacarpophalangeal joint. Between metacarpal and the phalanges, here is the several joint. And last, phalanges can also form joint between themselves. So the joint formed between the phalanges is called interphalangeal joint. Keep remember, in the thumb or pollex there is two bones. In the other fingers, which is index finger, middle finger, ring finger, little finger, there are three bones. This point is very much important. Next, we will see how forces transmit in the upper limb. Actually, when someone carry some weight, the force transmit to the hand. From the hand, it will travel to the wrist, then it will travel to the radius, transmit to the radius. From the radius, there is a ligament which is called interosseous ligament. From the interosseous ligament, it will transmit to the ulna, then elbow, then it will transmit to the humerus. From the humerus, it will travel to the scapula. From the scapula, it will travel to the clavicle through Acromioclavicular ligament. So this is the ligament which is present between the scapula and the clavicle. From the clavicle, it will transmit to the sternum through Sternoclavicular Joint, and from the sternum it will travel to the axial skeleton. So this is all about the introduction of the upper limb. Thank you.